Many thanks for joining us today. My name is Yorgos Franzis. I am CALP's regional representative for the Middle East and North Africa. And I would like to warmly welcome you all at today's webinar, which focuses on how cash and voucher actors rapidly adapted to COVID-19 pandemic in Jordan to continue providing critical support to refugee populations and meet increasing levels of needs. Since the beginning of the pandemic, 12 months ago during the first COVID wave, but also last December, CALP hosted 2 regional meetings where we asked the leads of cash working groups from countries across the region what impact COVID-19 pandemic was having, how they were responding, and about the challenges and opportunities for using cash assistance. I hear a comment that you're not listening to me. Okay, so yes, we invited cash working groups from all the region to ask them how the impact, how COVID-19 was impacting the response, how the cash actors were responding, and about the challenges and opportunities for using cash. Now, most countries saw cash as a critical part of planning an effective response. Nevertheless, as we all know, COVID-19 had introduced additional complexities around delivery caused by a number of aspects of this crisis. Now, these aspects included impacts related to access, impacts related, of course, to the financial ecosystem, the supply chain, the market functioning, livelihoods, and in thinking through, of course, what funding is needed to manage this pandemic. Moreover, during these meetings that we were having, but also during our regional thematic event on social protection that we organized last July, it was generally agreed and emphasis was given to the need for greater linkages and alignments between humanitarian cash responses and existing social protection systems, as well as planning with development actors for longer-term economic recovery. So in line with CALP's new strategy, we recognize that collective action is critical if we are able to achieve the change that is both needed and possible. We intend to continue materialize this strategy by continuing to encourage the dialogue between all of us cash actors, bringing the key issues on the surface and strengthening evidence and learning. Now, listening to the need of cash voucher assistance actors in the region to understand more around the topic of COVID-19, this case study takes a deep dive in the current context of Jordan, aiming always to contribute in documenting and assessing collective learning and decision-making on the adaptability of cash-based programs in Jordan in light of the challenges posed by COVID-19. Now, very quickly, I would like to say that this study has been commissioned collectively by CALP, but also and with our partners of Durable Solutions Platform and the Chameleon Network, but also, in fact, this study is a companion to a very similar one in Lebanon, carried out again by Durable Solutions and Chameleon in 2020. Now, before I hand over the floor to my colleague Julie, I would like to of course, give many thanks to Adre Dur, our consultant, for the great levels of professionalism he showed to carry out this study successfully. But most importantly, I would like to thank all of the colleagues from all the organizations for their willingness to continue proactively contributing in this study with their inputs and feedback. And last but not least, I would like to introduce and thank our panelists participating in this event. First, to start with Emmanuel Rodriguez, UNICEF's Chief of Social Protection and Policy in Jordan. Welcome, Manuel. Veena Krishnamurti, our colleague from the Basic Needs Working Group Coordinator in Jordan, but also Iman Dabas and Marwan Henawi from Jordan Hashemite Charity Organization. With that being said, I hand over the floor to my colleague, Julie. Julie, over to you.
Good morning, good late morning, everybody. As Yoga said, we're delighted to have you here with us today. So I'm here, I'm the research coordinator from CALP, and I'm going to just explain the agenda, and then I'll hand over to Andre. Please feel free to share your name and organization, introduce yourself in the chat, and put any questions you have during the meeting into the chat, and we'll share them at the end. So thank you very much. So first of all, Andre is going to give us his findings for the research that he's carried out. We'll then have brief interventions from the three panelists, and then we'll move to question and answer with the audience. So I'm going to hand over to Andre. I'm going to share my screen so that I can run the PowerPoint for him, and I hope you enjoy the meeting. Thank you.
Thank you very much, Julie. All right, so like Julie said, I will be talking briefly about the main findings and also the recommendations of this study that was conducted in Jordan. So essentially the presentation contains different components. We'll quickly talk about adaptation measures to cash implementation that were applied across the board, so to all cash programs in Jordan, humanitarian cash programs, I have to say. Then we'll talk about the COVID-19 emergency cash response that was implemented in 2020 to support vulnerable families. Then quickly mention a few specific adaptation measures related to cash for protection and cash for work. Then I'll talk about decision-making and coordination in that response and in taking these adaptation measures. Then very briefly to mention some of the similarities and differences between the humanitarian response for focusing primarily on refugees and the response by the National Aid Fund, which is the principal social assistance instrument by the government of Jordan. Then the main lessons learned, short and medium-term implications, and we will close with the recommendations to operational actors as well as donors. So very brief introduction. I think many of you probably work in Jordan or are familiar with the context, but just some of the key stats. So Jordan has approximately 10 million inhabitants. It hosts 750,000 refugees registered by UNHCR, as well as 2.2 million Palestine refugees. COVID, as in most other countries, arrived in Jordan early March. So the early March, there was the first case registered, and the government reacted by very strict measures to limit the spread of the virus. So there was quite a severe lockdown at the beginning, March, second half of March and April, that had quite a big impact on various things. We'll come to that. The socioeconomic consequences of COVID-19 on refugees were quite severe at the beginning and continue to be, I think, severe throughout the year. So certainly unemployment among Syrian refugees and among other refugees as well rose quite dramatically. And it was already high before the crisis. So this was really on top of an economic situation in Jordan, and certainly also for refugees that was already quite difficult. Many people lost their jobs during the full lockdown, which so during March and April, and many of them were not able to return to work throughout 2020. So there was a challenge for many of them to find new work. It was a reduction in incomes, remittances, an increased debt level, and negative coping that we could all observe through assessments and PDMs. The impact on humanitarian action was also quite profound. So there was quite severe movement limitations during the full lockdown for many humanitarian actors. And it was also difficult for many of them to react to government decisions, which were sometimes, which were kind of difficult to keep up with because there were so many of them, obviously. And it was also very difficult to anticipate how the situation would evolve. Now, the study, the objective was really to document and assess collective learning and decision-making on the adaptability of cash programs in Jordan, with a focus on basic needs, food security, and protection related cash programs. And I conducted a desk review as well as key informant interviews, so 25 people, or 25 interviews were conducted. So these are the adaptation measures that essentially apply to all of humanitarian cash assistance in Jordan. So the first set of measures really aims to reduce transmission risks during beneficiary engagement. I think that kind of was like a set of measures that was aiming to achieve that. And there we have staggering, so stretching out payments through a longer period of time, so that people don't have to queue up at ATMs, and there's no overcrowding, for example. Then also advance payments, so payments ahead of schedule was done by several organizations. Front loading, so assisting or providing 2 months worth of assistance in one go, for example, ahead of a lockdown. We also saw coordinated fund disbursement, so that beneficiaries that would receive payments from different organizations could collect them at the same time and didn't have to go twice to an ATM machine. We saw safety measures at transaction points that were ensured, so physical distancing, wearing masks, etc. Communication of COVID safety measures as well by different organizations. So some people sent out regular safety messages to their beneficiaries. And there was some specific measures that were undertaken by Cash for Work implementers, which I will mention later on. The second set of measures were aimed at ensuring that beneficiaries can collect their benefits. So there also various measures were taken, including, for example, mobile ATM machines that were moved to locations where people did not have easy access to ATM machines, and also expansion of ATM networks, particularly WFP really made an effort to expand their network. Then also a move away from ATM cards temporarily and physical distribution. ATM card distribution was very difficult during the full lockdown because there was no access to or limited access to the beneficiaries. So these distributions were severely disrupted. And during that time, there was a need to find other solutions. These solutions included, for example, a move towards tokenless transactions. So distribution mechanisms that don't require a distribution of a token, like, for example, an ATM card, and that includes mobile money or iris-enabled ATM distribution that was certainly done a lot in the response. Then a move towards service providers that were able to deliver during the lockdown. So certain service providers, they had the required permits and they were able to move around freely. So many organizations also contracted them at an early stage or also at a later stage as a backup plan. Mobile ATMs already mentioned. Remote shopping was something that WFP did in camps, where people would be able to order food from shops, especially vulnerable groups, and then would be able to pay with their cards. Yeah. And also the CCF, which is the Common Cash Facility that offers different distribution mechanisms to its members, including iris-enabled ATM and mobile money. They became more important as a platform, and different organizations joined them in 2020. Just to sum up slide before, so these were two important sets of measures. So measures to reduce transmission risks and measures to ensure that beneficiaries can collect their benefits. And the third group of measures was measures to ensure communication and accountability with refugee populations. And their measures include things to promote remote work modalities. So organizations switched to phone surveys for assessments, PDMs, etc. Home visits and data verification were also done through the phone. And I think for protection actors and also for others, but particularly for protection actors, the service provision was also done remotely. So case management, psychosocial support through the phone, which was certainly a challenge, and we'll come to that later. Then organizations increased the capacity of the helpline. The helpline proved to be an extremely valuable tool during this crisis for many organizations. And helplines were, the capacities of helplines were at times stretched, some organizations reported. And then also strengthen new technology, so the introduction or the expansion of mass SMS, the increased use of social media. So these were all measures to ensure communication and accountability with the refugee populations in times of limited access. Good. Then, in addition to these measures that were basically applied across the board, there was also an effort to respond to increasing needs, and that is really the COVID-19 emergency cash response. So this was a response in addition to the regular cash transfers, basic needs, cash for protection, etc., that was already planned and kind of anticipated for 2020. So that was on top of that, and in principle, with a few exceptions, it was a horizontal expansion of the basic needs response. So that response was in addition to the regular cash assistance, and it was a horizontal expansion. So essentially expanding the caseload temporarily of the basic needs response. Yeah. So some of that was done within the framework of existing programs. So expanding existing programs to new groups of beneficiaries, as well as some organizations set up new projects, particularly for that response. And most of the money came through additional funding, but there was at the beginning certainly a lot of reprogrammed funding as well. So reprogramming of activities and shifting budget lines in order to make sure that additional households could be added to the response. So overall, approximately 60,000 UNHCR registered households and about 25,000 Palestine refugee households were assisted in 2020 through that emergency response, and approximately 31.4 million Jordanian dinar were dispersed. So that was quite a meaningful response overall. Overall, the response was evidence-based, so there was a lot of, and we'll come to that, but the decision-making was certainly based on needs assessments. It was meaningful for the recipients. I mean, it didn't solve all their problems, but certainly it was an important contribution to the household economy at the time. It was relevant and it was relatively timely. So the first disbursements already happened early April and then continued throughout the year. And we could also see from post-distribution monitoring reports that it had a positive impact on the living conditions of refugee households, on their ability to meet basic needs, on their stress levels, and on the financial burden. Good. And then certain specific things on cash for protection and cash for work. So yeah, I think cash for protection, I think when I spoke to the practitioners, I think there was a clear recognition that complementary interventions, including case management and protection service provision, are really essential to achieve protection outcomes with a cash component. So there was certainly from their perspective, the fear that you might have that people will just drop all service provision and just focus on the cash transfer, that didn't necessarily materialize. And there was really an effort to make sure that these protection services and case management services were really upheld during the crisis. There was, however, a big challenge in how best to implement these interventions in times of COVID. But we could also see that, the crisis itself created a lot of protection concerns, and many organizations started to pay more attention to protection from sexual exploitation and abuse in the framework of COVID-19. The Cash for Protection Task Force, which is a specific group that aims to develop guidelines on cash for protection in Jordan, they didn't play a coordination role for adapting cash for protection interventions in response to COVID. So in comparison with the basic needs response, the cash for protection response was certainly less harmonized in 2020. Yeah. Now for cash for work, as already mentioned, there were some specific measures that were put in place to ensure that these activities could continue. So the safeguard plan on how to adapt the workplace was put in place in May, and also based on Ministry of Labor regulations, and then a process mechanism on how to deal with suspected and actual cases of COVID-19 was released in November. So these measures were quite important in order for cash for work projects to continue to operate in a quite challenging environment. In terms of decision making and coordination, so decision making for the response was mainly taken internally and in coordination with others. So for some organizations, the external coordination was more important than for others, but overall, most organizations agreed that both elements were important. And in coordination with others essentially means the basic needs working group, which was a kind of a key venue for people to meet and discuss, and the COVID response task force that was formed under the basic needs working group, and then also the common cash facility task force that had an important role to play. Decisions were taken on the basis of needs assessments, of which many were conducted in the immediate aftermath of COVID-19, so between March and May, June, I would say. Information from helplines that really helped to inform the response, as well as common sense, many or some key informants mentioned. And most key informants felt that they had sufficient information to take decisions on how to adapt their cash programs in response to COVID-19. Beneficiaries were, with some exceptions, not consulted on adaptation measures, and the main reasons mentioned by key informants were for not consulting with their beneficiaries on these measures were a lack of time and not wanting to raise expectations. Yeah, so these were the main reasons. Now, donors were overall seen as flexible, supportive, non-directive, and they were considered as partners by most key informants. So that relationship with the donors in order to adapt programs and make the required changes, but also raise additional funds, that overall worked very well. In terms of coordination, so like I mentioned, the two main groups were the the COVID response task force and the common cash facility task force. And based on the feedback from key informants, these groups were well coordinated and the participation was beneficial essentially to everybody that was interviewed. The COVID response task force produced standards for different criteria that allowed a harmonized response. So for example, in regards to the approach, meaning targeting families that lost their jobs as a result of the crisis, for example, targeting, like I said, the amount, some communication elements as well. So there was an approach that was established for most of the participants of the basic needs task force. Yeah. And most organizations actually followed that response, which was very positive, obviously. And for example, the Common Cash Facility Task Force, they were able to advocate and coordinate with the Jobpack, which is the Jordan payments and clearing company, to enable mobile money online registration for Syrian refugees as well. So that was important to be able to use also mobile money for the horizontal expansion in that response. Good. Then a few words on the humanitarian and the humanitarian cash response versus the response by the National Aid Fund targeted towards Jordanian nationals. So the NAF provided monthly assistance over 3 months to 240,000 vulnerable households, and with a similar target group as humanitarian actors. So it was households that derived their income from the informal sector and that lost their access, lost access to income. And they also provided the top-ups for 55,000 assisted households that were part of other ongoing NAF programs. So also quite a sizable response on the government side. Now there's quite a few similarities between the two systems at the technical level. So when I talk about the two systems, I mean the humanitarian cash response kind of infrastructure and the one provided by the National Aid Fund. And that is, for example, in regards to targeting, which is based on vulnerability ranking for both systems, as well as the use of e-payments and mobile money. And also in terms of procedures, for example, for registration and enrollment, there's a lot of similarities on how the systems work. And one of the key informants mentioned or expressed that Jordan could really be a laboratory for alignment and integration of social assistance and humanitarian cash assistance. But so far there's been limited progress, but a lot of key informants recognized that there is a need to explore alignment and to see how these systems can work better together, and with maybe the ultimate goal to integrate also some refugee populations at least into national systems, but that might be still a long time away. Then also one thing that is not yet determined is, the right level of alignment and integration between the two response systems. So how could that alignment actually look like, and which technical areas should be further explored in terms of further bringing the two systems together. And the objective should also, I think, is something that needs to be agreed on. I mean, from my perspective, it's certainly to maximize efficiency and effectiveness, but also to safeguard humanitarian principles and protection of refugees. So that also some key informant mentioned that these are important considerations when discussing strengthened alignment and integration between the two systems. Main lessons from this 2020 response and from adapting cash programs in 2020 in Jordan. I will go quick because some of the things I already mentioned. So one of the key ingredients was really the strong payment systems that at times, or some of them, did not require tokens. So the iris-enabled ATM and mobile money really allowed for a horizontal expansion based on very limited contact with beneficiaries. So that was certainly key. Then also new service providers that were able to operate during the lockdown, they were helpful. The existing databases were really quite important in order to be able to target the new beneficiaries. And these databases were largely sufficient, although, as we see in one of the things to improve, they were not always accurate. So certainly there needs to be more effort in making sure that these databases are as accurate as they can be in order to use them for an emergency response. Then the helplines were really key, and I think they were kind of good enough to get the organizations through the crisis, with a recognition that they also need to be strengthened and made more user-friendly. Flexible fundraising solutions, that was important, as well as strong internal and external coordination and decision-making, and readiness for staff to work remotely. Now, certain things to be improved for the future. So certainly in terms of contingency planning and preparedness, the international actors predominantly, they were not able to move during the full lockdown, or at least during the first stretch of the full lockdown. So this is certainly something that needs to be addressed in case there might be another lockdown at some point in Jordan, and also just the recognition that not to put all the eggs in the same basket, so to have a diversity of service providers that can be called upon if necessary. Database accuracy I mentioned, helpline I mentioned. More predictable funding was an ask from some key informants, because certainly for the more longer responses, for example, UNICEF that had a response not only for a few months, but really throughout the year, the funding kept trickling in, which was an obstacle for planning and communicating the response. Then also readiness, so the promotion of readiness for staff to work remotely. I think overall it was okay, but maybe some staff didn't have the required internet connectivity or IT infrastructure to be able to work from home. And there is certainly things that can be done to promote that. Communication on targeting was also mentioned. So the targeting criteria for the expansion They were quite, I mean, as usual in these kind of contexts, they were quite complex, so it was difficult to communicate them, and I think there was a recognition that more effort needs to be done on that front. In terms of implications, for the short and medium term, in the short term, as everybody that lives in Jordan, as you all know, the situation remains fluid, and so the message here is to be prepared. The needs, or many of the needs, are still there. The economy is still very weak, and although we don't have very much updated data there, but a lot of the refugees might not have been able to get to a level of earning that allows them to self-sustain themselves. So the needs are still there. What I observed during the second half of 2020, that there was a lack of needs assessment. So a lot of needs assessment were done in the immediate aftermath of COVID-19, but very little was done to kind of track how the pandemic and the economic environment continued to affect beneficiaries during the second half of 2020, and that might still be actually the case today. So a need for more assessments to keep track of that. A likely need for a follow-up response. This is a bit speculation, but I think a lot of key informants felt that the situation probably is even worse, or was even worse at the end of last year than it was at the beginning of the pandemic, because people might have exhausted some of their resources and assets. So there's a likely need for a follow-up response to target those families that have not been able to find jobs and generate income. On cash flow protection, I think there's an opportunity to learn from last year's experiences, and I'll come to that in the recommendations. And yeah, need to find creative solutions to strengthen resilience and livelihoods of refugees in this very difficult economic environment. And I'm sorry to say that I don't have any more specific things to say on how to achieve that. In the medium term, I think the study kind of offers 3 entry points for strengthening resilience and self-reliance of refugees. First entry point is strengthened access to formal labor markets for refugees, because we saw in the crisis that the formal labor market was much better protected than the informal one. Then to strengthen alignment of humanitarian cash assistance and government social assistance, and to take the required steps to explore this better and find solutions for alignment and integration that actually makes sense in the context of Jordan. And then the third one is really to use more mobile money in the humanitarian response as a vehicle to strengthen actually financial inclusion, which is something that many of the current transfer mechanisms don't offer. And mobile money is also one thing that the government has quite used at scale during its own response. So that might also offer opportunities for aligning the two systems on the delivery side in the medium term. On the recommendations, and I will be brief. So first thing already mentioned, so to better assess and document the needs. And then the second one, based on those needs assessment results, to advocate and plan for basic needs COVID-19 follow-up response in 2021. But maybe the other the 3 key informants that will speak later can also speak on that. I'm not sure what the planning is there. Within the framework of that response, certain things could be looked at, and these are more suggestions from my side based on my observations. So one thing is really to harmonize the cumulative transfer amount rather than the monthly amount, because the monthly amount was harmonized. Most people received assistance worth 3 months, but not all. So it was really quite, for those who only received assistance worth 1 month, was quite a big difference to other households. But then one thing that could be explored is really the provision of a one-off grant rather than monthly assistance to promote economic recovery. So rather than providing 3 months worth of assistance, really provide one grant that gives people a bit more flexibility in how they can spend it and a bit more leverage. Then strengthen communication on beneficiary selection and exclusion. You already talked about that. And also this is something, so a lot of the NGOs primarily, they are required in their humanitarian work to include 30% of Jordanian households in their response. As part of an emergency response, I think, because the government is already doing quite a lot for Jordanian nationals, there could be exploration on whether that could actually be waived as part of an emergency response. So that is something that could be explored. Then recommendation number 4 is really to put in place contingency planning and preparedness measures for a full lockdown scenario in 2021. So far that scenario hasn't come in place, but the year is still young. So this is something that is important to keep in mind. And that that touches upon permits, yeah, and also making sure that the delivery mechanisms are operational during a lockdown scenario. So to make sure that all organizations have the required diversity of service providers to make sure that they can deliver cash in a full lockdown scenario. Expansion of mobile money for cash payments, we talked about that as one recommendation. Then for cash for protection, to learn from last year's experiences and to potentially develop best practices and recommendations on cash for protection programming during COVID. This is something that was done in Lebanon, so maybe something to look at. And then to contribute to efforts and steps to align humanitarian cash and NAF social assistance. And sorry, I forgot to mention, these first 8 recommendations, they are addressed at cash implementers and cash coordination groups. Yeah. And then recommendation 8 to 10 are addressed towards donors. So there we have, in addition to supporting the regular cash-based programs for 2021, consider funding an emergency cash response related to observed needs in 2021, and also retain and maintain a high level of flexibility of partners, allowing operational actors to adjust projects and budgets to respond to documented needs on the ground. So really similarly as it happened in 2020. And the last one is really to lead on efforts to align humanitarian cash assistance and NAF social assistance. And this, this includes to promote a common understanding and agreement among stakeholders on what level of alignment is desirable in the medium term and what actions are required to get there. So really, this is, I think, donors are best placed to exert the required pressure there. And that's it. So I hand over to Julie.
Hello. Thank you very much, Andre. Now we're going to move on to hear from 3 actors from the Jordan cash scene. And we'll start with Veena Krishnamurti, please.
Thanks, Julie. My name is Veena Krishnamurti, and I work with UNHCR Jordan and also co-chair the Basic Needs Working Group. So last year, in the onset of the COVID-19 emergency, the Basic Needs Working Group, in coordination with Shelter and Protection, set up the COVID-19 Emergency Response Task Force. If you could go to the next slide, please. And the objective of the task force was ideally to develop a standard and a coordinated response to any potential economic crises that would come, that would affect the refugee population. That would affect the refugee population due to lockdowns or loss of opportunities, work opportunities, etc. And we really looked at identifying that population that was previously engaged in some kind of economic activity, and then because of the lack of work or lockdowns, as we now know, would become vulnerable. So the rest of the slides actually look at what the targeting criteria was, what the assistance package was. If we could just go to slide number 5, where we talk about coordination. That's where ideally I would like to talk about what the lessons learned are. So we did, I think Andre's presentation really talked about the coordination that we had with the Common Cash Facility and the innovations or the approaches that we had to take to ensure that the assistance that we wanted to deliver, going beyond the basic needs assistance, we are able to deliver to the persons of concern. So we had the mobile ATM vans, we had, we had mobile wallets, where online registration for mobile wallets started in, I want to say, in May 2020. Which allowed Syrian refugees to be able to register for mobile wallets online, and that allowed us to reach out to this population quicker. But beyond that, we also had in May a rapid need assessment that was conducted by WFP, UNHCR, and UNICEF that really talked about the socioeconomic situation of refugees, those that were receiving cash assistance and those that were not receiving assistance. During this period, we had so many partners and organizations that worked on providing highlights in terms of what was happening with the economic situation of refugees due to the COVID situation, the protection needs, etc., which kind of tapered down towards the last quarter of 2020. One of the key lessons learned that we had were the fact that there were a lot of data that partners and UNHCR was collecting, but as a sector, we did not really look at highlighting this. And this was something that we hope to kind of be able to do better going forward, irrespective of whether there's a COVID or not. The second is the preparedness in terms of being able to switch from things that we do face-to-face to switching to do something, on using telephone, etc. So during the lockdown, during that period, one of the things that we worked on was doing a phone assessment survey. Instead of in-phase interview that would be required to conduct home visits, that formed the majority of, that really informed our eligibility criteria and identifying the population that were in need. So having a system that would allow us to switch where it was required was something that we were not prepared for as a sector and as UNHCR. And this was something we worked on in addressing in 2020, that in case we are faced with a situation that is similar, we would be able to respond in need. The third one was helpline. And I think Andre mentioned this as well. When we are designing system, we kind of forget that it needs to be client-centric, that population needs to understand, the ones that the user needs to understand how systems work. We have a really nice helpline system that's open to partners as well as for refugees to use in terms of reaching out and requesting assistance in different means. But the system is a little complicated, and we don't communicate as well in terms of how it needs to be used. So during 2020, the last quarter, one of the things that we worked on was an animated video and social media post that talks about how the IVR system really works. The fact that we have tickets that are raised and you don't need a human to be able to ensure that your complaint or your issue reaches the right unit. We have seen that we are also working on upgrading our system, increasing the number of lines that are there that would allow more persons of concern to be able to reach out. And the last one, again, goes back to communication, is communicating who's eligible. Now, this is always a challenging situation when it comes to cash, because over-communication can lead to manipulation, under-communication can lead to frustration. And this is something we saw last year and continue seeing when it comes to cash assistance, the number of complaints, the number of challenges, the negative media messages, etc., that we receive in terms of why is this person getting assistance so many times? Why is this person not getting? Why is that, we have all lost opportunities. So how come this person is being targeted versus the other person who's not being targeted? So having an approach that is transparent in terms of communicating who is eligible, who's not eligible, but making sure that it does not lead to further manipulation or misinterpretation is also critical. And this is something we are really working this year on, to see how best to communicate in a way that is transparent and clear, but also doesn't result in over communication. And we are hoping that as a sector, we would be able to bring these improvements in any cash assistance programs that we have in today and in future. So that's all I wanted to speak about. If there are any questions, I'm happy to take them right now. Thank you.
Hi. So I think we'll save questions till the end, because I can see you're answering some of the questions that have been asked to some extent. So now I'd like to hand over to Emmanuel Rodriguez, who's from UNICEF Jordan and who's head of Chief of Social Protection and Policy. Thank you very much.
Thank you so much, and thanks to Kat for the invitation. I will try to stick to the 5 minutes to have the chance for the question and answers and the discussions. But very quickly, before the onset of the COVID crisis, through our cash transfer program at UNICEF called Hayati, we were supporting around 11,400 children between 5 to 16 years old, using a pure vulnerability approach regardless of the nationality. With the onset of the crisis, of the COVID crisis, and the subsequent lockdown, we were able to upscale our Hayati program as part of our social protection response by around 19,000 children. Also, we opened the, let's say, range of age, because on the expansion, we were covering from 0 to 18 years old. So in total, we were able to reach around 30,000 children as part of our COVID response. And this upscale, we were able to do it in less than a month and a half since the first lockdown here in Jordan. That was March last year. In terms of the groups, as I said, we use a vulnerability approach. So 90% of our beneficiaries on that expansion were Syrian refugees, 7% were Jordanians, and around 3% were other nationalities, Pakistanis, Iraqis, etc. In terms also of how was the composition, 50% of our beneficiaries were female, 30% of the beneficiaries belong to a female-headed household, 15% of the beneficiaries also were children with disabilities, and this expansion took place basically in host communities and ITSs. ITSs are the internal 10 settlements here in Jordan. In terms of lessons learned, I think that we should focus in 4 key aspects. The first one was the issue of having a comprehensive database of potential beneficiaries. I mean, our database is not just covering the beneficiaries of our program. We have a more extensive that has, let's say, eligible and also non-eligible, and that was a key aspect to allow us to upscale fast. The issue of having systems in place, we had a payment mechanism in place based on iris, also debit cards and mobile money. So we have the 3 options already in place. Also, we have a communication system, 2-way communication system that it's called Rapid Pro, which allow us through SMS to collect data, but also to inform the beneficiaries about the payments. And then another aspect to highlight is the flexibility of available funds. And that's something that also we should keep in mind as part of the enhancements to make our system more shock responsive. We see every day that the support that comes from donors, it's earmark every day. So we need to establish some kind of flexible arrangements in cases of emergency that may allow us to have access to those resources to be able to make disbursements faster. Then also, in terms of, let's say, opportunities for improvements or things to enhance, as I said, we need to keep working on making our system more shock responsive, but also strengthening or putting in place the building blocks to facilitate the nexus between the humanitarian and the national systems. As you may be aware, here in Jordan, on social assistance, I mean on cash and in kind, we have, let's say, the limitation that by regulation, non-Jordanians cannot receive support through NAF. So basically what we are doing is trying to use the systems that we have developed on the humanitarian side to strengthen the national system, and with the long-term vision that at some point we can create some kind of interoperability mechanisms between both. But with this, I will stop because I see that it's already 1 to have chance to interaction and question and answers. So over to you, Juliet, and then on the question and answers section, we can interact.
Thank you very much, Manuel. That was great. So I'd like to hand over to our last panelist, who is Emmanuel Rodriguez from the Jordan Hashemite Charity Organization. Over to you, Iman.
Hi, I'm Iman. So let me introduce you GHCO, which is Jordan Hashemite Charity Organization. I'm Iman Dabbas. I'm a planning coordinator at GHCO. We are a non-profit organization. Basically, our government, Jordanian government, gave us a role to supervise on other organizations' projects regarding with in-kind and cash projects. GHCO established in 1990, and our main role to other organizations to coordinate with us on their cash projects they implement, basically in host communities. So our role in host communities with regard to Syrian refugees and Jordanian. Regarding the refugees, we gave them the assistance. We take the names of Syrian refugees from UNHCR to deliver them the assistance they need, and for Jordanian we take the names from NAF. So in regard with the procedures that we implement with other organizations, NGOs or NGOs, we give them the facilities to, with regard to governmental entities in implementing their projects in host communities, such as to contact with CBOs or the government or other procedures. So in regard with the cash transfer, since the eruption of pandemic, we basically focus on delivering the daily workers food parcels, and in regard with money cash transfer, we depending on ATM cards in regard with Jordanian. And for Syrian refugees, we deliver the assistance through iris scan after taking the names from UNHCR. We are basically targeted through the pandemic, whether refugees or Jordanian, the daily workers and people who lost their jobs.
Iman, sorry to interrupt, because we're running out of time. Maybe you can focus on what are the main learnings of JHCO in regards to this, to your cash programs in 2020. I think that will be very helpful. Julie, are you there?
I'm here. I'm worried. I think we might have lost Iman there. Iman, are you there? Otherwise, I think we might move to some of the questions. And then if Iman comes back in, she can join in the discussion.
Okay.
Great. So, so the questions are for all the panelists as well as Andre. So please chip in if you have some perspective on that. So there's some interest in the Jobpack and what this is, how it works, and how it might relate to financial inclusion, which I know is a topic of great interest in the cash community because we hear great things about what financial inclusion might do. But I do think so far the experience has been more optimism than delivery. So can the panel join together and tell us about the Jobpack and how it's been used?
So if I may, Juliet, maybe on that one?
Please.
Yeah. Oh, so maybe as a quick background, in 2015, the government of Jordan decided to enhance their framework of payment systems in the country. And at that time, there was an entity called, I think, National Payments Council, who was in charge of everything. Let's say the oversight and also the operations of the payment mechanisms. So in 2017, the Central Bank of Jordan decided to create a private entity jointly with 25 banks in the country, Central Bank of Jordan plus 25 banks. They created this, what it's called Jordan Payments and Clearing Company, the Jobpack. So the Jobpack is in charge of, let's say, managing or operating some of these payment mechanisms, such as the Jomo Pay platform, which is the switch for mobile money payments, but also they manage the e-Favotir, which is an app to do micropayments and paying the bills and all those things. So that is the Jobpack. So in the context of the COVID response, one of the key tools or delivery mechanisms for payments that we're using in the country on the humanitarian side, but also on the national side, was this Jomo Pay platform, mobile money, using around 5 different service providers. And the switch that those 5 service providers were using was through Jobpack or the Jomo Pay platform.
Thank you. And Veena and Andre, so any thoughts on the Jobpack and what hints there are about how it might improve financial inclusion? And by financial inclusion we mean the set of financial tools available, particularly to refugees. Those of us in luckier situations have access to credit, to mortgages, to credit cards. So we have a lot of financial tools which we can use when we hit hard times. And the argument's always been the more financial tools you can provide, the easier it will be for people to manage their money better. But any signs of that being promised by the Jobpack?
So maybe if I can jump in and start off. So I think the first thing is also to highlight the fact that non-citizens do not have the same access to mobile wallets that the Syrian population have. Even though there has been changes in regulation that allows this online wallet registration for with using the MOI cards for non-Syrians, they still need a valid passport to be able to register. So there is still a bottleneck, even before we move on to talking about financial inclusion. There is still that differentiation between what access Syrians have and non-Syrians have. The second is, yes, mobile wallets is a great tool, but one of the things that at least we are discussing with Jobpack, and this is more from Heba's side from CCF, I'm just stepping into his counter this, is also moving beyond just having access. Access is ownership is just one part of it. We need to move beyond ownership to what are the other products, what are the use cases that we can build with using a great tool like mobile wallets. What else can we do with it?
Sorry, Veena.
My voice is not heard. Can you hear me?
We're not hearing you properly. Can you maybe just go back to the beginning, not right to the beginning, but just go back a couple of sentences.
Okay, I don't know which part you lost me. I'm just going off headphones.
I think you were talking about the need for passports, the different
right.
situations.
Sure. Thanks, Shirley. So for non-Syrians, I'm just going to say that for non-Syrians, we still don't have the same access and rights. For non-Syrians, they don't have access to a MOI card, and hence they have to provide a valid passport to be able to register for a mobile wallet. So this is one of the first points of advocacy that we're having with Jobpack, so that we can work with the central bank to kind of advocate for a relaxation and the KYC norms. The second thing is access to who becomes an agent, right? Yes, we have right now we have PSPs, we have mobile wallets, but how do we encourage usage of mobile wallets? If you can't encourage use of mobile wallets to just going beyond cash outs, then you're not going to be able to build a transaction history, which could then help them access to credit in future if PSPs want to look at that product, or insurance, micro insurance, microcredit, or any of the products that we as a fully banked population don't think twice about. We won't be able to provide that access to the refugee population. So the other point of advocacy that we are having, and this is a joint project that is led with UNICEF, WFP, and UNHCR, is really talking about who could be an agent. So we're doing this in the camp, but the idea is that we will be able to kind of advocate for this outside the camp as well. So the requirements that we have for a mobile money agents are so strict and stringent that most of the population in rural areas or semi-rural areas or camps would not be able to comply with it. And if they can't comply with it, then obviously they will not be able to provide that services. So this is another kind of discussion that we are having with Jobpack. The third and most important is, I really hate to use this term, but financial literacy or education, as we say it. Right now, again, everything that we are doing talks about product marketing and not necessarily financial education. So this is again something that we are really talking with different partners. Again, discussions with WFP and UNICEF in terms of, at least when how do we kind of, it's part of the technical working group, one of the deliverables, how do we make sure that there are, we engage with the regulators to develop products that would, financial education products that go beyond marketing to actually education in terms of how do we bring in awareness of what you can do with your SIM cards, with your wallets. How do you ensure that you keep your same SIM card and not, or wallet number, and not give it off to somebody else, etc., and like build the transaction history. So these are kind of some points that we are having discussions with Jobpack and the Central Bank of Jordan to kind of talk about financial inclusion. On the other side, if I can touch upon livelihoods as well, the different livelihood partners that we have in different projects, having mobile wallets, because this is the only bank account or formal financial tool that a refugee population can own. One of the things that we are doing as well as different products, can we start using mobile wallets as a base so that, again, we can build the transaction history for linkages to formal sector. Over, unless there are questions, I'm happy to answer. Thank you.
Thanks. That was a brilliantly comprehensive response, and yeah, I think that you've identified some clear points for advocacy moving forward. Another question that came up was about I think it's the Cash for Protection Task Force. So who was involved in that? How did it work? I think it might, it's stopped, I think, for the moment, hasn't it? But maybe Andre, you'd like to run through that?
I think, I mean, the Cash for Protection Task Force was set up specifically to develop guidelines on cash for protection programming in Jordan. And I think these guidelines, they exist in draft format. So they were never meant to be a body to coordinate programs as such. Yeah. But yeah, I mean, it's led by UNHCR jointly with Inter-SOS at the moment. So I'm sure they would be able to tell much more on where exactly they stand with the specific task that they were asked to to deliver. Yeah.
Thank you. So we've been asked if we can give some really big picture information about the amount of cash that was delivered, the numbers, the volume of beneficiaries. And I think that's quite a big ask, quite a lot of detail for this sort of webinar. But you know, it was really interesting the way that Manuel was talking about the scale up of the programming for vulnerable children. Do we have some sense of where the increases took place to respond to COVID? I mean, you had your normal programming before COVID. Do you have some just, you know, back of the envelope figures about how many more, you know, the horizontal expansion, how many more people, or the vertical, the top ups? That would be, I think that would be quite interesting to get a sense of the scale. Veena, yeah. I think maybe you could, Manuel, do you want to have a first go, or shall I let Veena jump in? Okay, Veena, take it first, please.
Sure. So I can talk about the basic needs sector or the COVID-19 emergency response. To date, we have reached 63,646 additional families. These are not families that are part of the basic needs assistance or receiving cash for shelter. Just as a sector, going beyond the regular monthly cash programs, we have reached 63,646 families, of which majority of them have received at least 2 times of assistance. So if you see my presentation, the assistance was planned for a period of 3 months, meaning that it doesn't have to be consecutive. Across the period of assistance, you are eligible for 3 months of assistance. So as a sector, I think we had about 20 partners that were providing cash assistance, and we were able to reach about 63,646 families, a majority of them over 2 times. This does not take into account WFP's horizontal expansion as well, because they had added in quite a lot of cases. I don't have those numbers, but this is what I have right now. And in the presentation, if you share it, you will have a link for the COVID-19 emergency dashboard that was prepared, and that has all the numbers, and it's a live dashboard that's updated on a daily basis. Over.
Thank you very much. That's great. Now we have another question, which is for Andre, about your recommendation that in some instances it might be more useful to provide one-off grants. And I think this is referring, if I understood it correctly, to where you're suggesting that maybe, is it larger one-off grants might be a more useful livelihoods intervention? Is that the one?
Yeah, I think it relates to that, yeah. Exactly. So this is really, I mean, it's this is really coming from my experience also with, you know, having discussions whether we should provide monthly assistance rather than just bundling all together and just providing it as one payment. And of course, in the end, the amount is the same, but the objective and the perspective might be slightly different. I know from some experiences that providing one-off grants just gives people a bigger amount that they can then use to address needs related to their basic needs or to their livelihood needs with a bit more strength, so they just have more money available. With the risk, of course, that they're going to spend everything at the beginning and not necessarily have enough money then to sustain themselves through the period of time that was actually planned with that intervention. But I think the evidence, although it's not very strong globally, there's some evidence showing that from a livelihood perspective, a one-off grant is probably better. From addressing kind of basic needs, food security needs, etc. perspective, monthly payments are probably better. Yeah. But in a situation where your option is either to where anyway the time period of your intervention is quite short, so it might be 1 month anyway, then it's one-off, or 2 months or 3 months, you might actually want to consider that. The important thing in that respect is also to make sure that this is something that you really need to speak to the beneficiaries. You shouldn't just decide that by yourself, but really consult with beneficiaries to see what their preferences are. And they might well say, well, we actually prefer that you give us the assistance in installments rather than as a one-off. But it's from my perspective, I felt it was something that might be worthwhile considering that anyway, the payments are not for the entire year, but rather for a couple of months maximum.
Yes. So we're getting.
If I may, sorry.
Please jump in. Yes.
Yes, thank you. Andrea, just wanted to kind of just engage with you on this topic. When we are talking from a basic needs, I think you mentioned this, basic needs and food security, it does make sense to give monthly assistance and not lump sum. From livelihood, yes, depending on what the assistance is for. If it is to start up a business, if it is to start up some kind of initiative that moves towards a path of self-reliance and not for consumption assistance, then yes. But a number of programs that looks at it, looks at livelihood as well, there are different components associated to it. So I think I would be a little hesitant to say that one-off assistance or a lump sum assistance is better than a monthly cash assistance. I think it has to be situational. It also depends on what is the purpose for which the assistance is provided. Just wanted to clarify that point. Thank you. Over.
No, I think that's a really good point. I mean, actually, globally, in response to COVID-19, we've seen quite a few instances of monthly payments being bundled up into 3 months or 4 months. But I think in the context of very limited access to livelihoods, it could, and the uncertainty of lockdown and access to markets, it might in fact make it harder for people to manage. But this is something we're learning as we go along. So we have a few minutes left, and we have a couple more questions. There's one I'm not completely sure. It's for Andre. No, hang on a second. Yes, it is for Andre, and it says, was there a significant cost for delivering this cash to beneficiaries on the service provider part? Now, the service provider part is the bit I'm slightly unsure about. Is that, I guess, is referring to the financial service provider?
Fees and things.
Yeah.
I think Manuel will probably be best placed. I'm not sure exactly about the fee structure, but the CCF has agreements with all these service providers that they were able to tap into. Maybe Manuel, you want to quickly take that one?
Yes.
There are, depending on the type of payment, I mean, it was through the IRIS, the debit card or mobile money. Through the CCF, we have a contract with the Cairo Amman Bank in this case, in which we have a table of fees. I mean, out of my mind, I cannot tell you exactly what are the fees with Veena. I don't know if you have it in your screen, the fees tables to provide a specific answer on what was the percentage charge per
1%. 1% is what the organizations had to pay to cover so I think I'll just separate the two things. One is that the financial service providers do not incur costs, they charge us. So we as organizations have to pay the financial service provider to deliver the assistance. So under the CCF, which has about 40 members, we have a negotiated rate for bulk transaction fee, meaning that if you are transferring assistance at one time to, let's say, 5,000 families, then 1% of that transfer value is what is agreed upon, is what you as an organization would have to pay the service provider, the financial service provider, to deliver this assistance. From the persons of concern side, if you are using the iris biometric or ATM virtual account that is linked to an ATM card for withdrawal, then you do not incur any charges. That cost is also bundled on the cost that we pay to the service provider as CCF members. Whereas for mobile wallets, this the rate of withdrawal, the charge that you have for withdrawal is not bundled in the contract because it changes as per the value of assistance, and the refugee has the right to withdraw as many times as possible. So in that case, in mobile wallets, there's a charge that the person of concern has in terms of withdrawal. But again, the cost of transactions is negotiated by the CCF. So just because we had a COVID response, it does not mean that we had to pay a higher cost, because the transaction fee was already negotiated 2 years back through the CCF contract. We all actually leveraged and were able to kind of manage this cost. Thanks, Manuel.
Thank you. So in the chat box, we have a comment from Liz Hendry of Chameleon with regard to the frequency of payment. And this study, as we said at the beginning, this is a companion study and was inspired by work done in Lebanon by Chameleon and Durable Solutions Platform, who were our partners in this work. And there's been a lot of joint learning, which we're sort of going to turn into a small brief. But yes, again, in Lebanon, the refugee households, they wanted monthly payments because when you're managing a small amount, when you've only got a small amount of money and you've got to get through the month, it's much harder when you're given a little bit more and you have to get through 3 months, and it's their sole source of income. So we're beginning to move towards the end. A 1-minute comment from each of you before I wrap up. What have you done in Jordan for the COVID-19 response that you think will stay with you as an organization? Maybe that's a bit of a hard question to throw at you, but I suspect you'll know. We'll start with Manuel, please. Yeah,
maybe in 30 seconds, 2 things to, let's say, focus in the short term. One, this is a protracted crisis. I mean, we here in Jordan, we are now on our 2nd wave, and the specialists are saying that we may have a 3rd wave end of the year. And the support, the financial support, it's going down. So we need to find ways to, let's say, how to finance cash assistance in this protracted situation. That's one. And 2, how to strengthen or to put in place the building blocks for the nexus. In Jordan, we have 2 systems that are running in parallel, regardless that we have like communication, but the systems do not talk to each other, the national systems and the humanitarian. So that is, or should be, like one of the top priorities on the national agenda on cash. Over to the colleagues to have the time to.
Veena, 1 minute.
Echo Emmanuel's sentiment. We cannot have 2 parallel systems running to support vulnerable population, irrespective of whether they are citizens or refugees. There has to be alignment in terms of the purpose, alignment in the way that the transfer is given, alignment in whom the transfer would be given. So we are hoping that either the joint comprehensive vulnerability assessment that's going to be led by all the organizations and with the government of Jordan, or the vulnerability assessment framework population survey that will be conducted this year would really inform and build a common indicator of what that vulnerable population would look like, and then hopefully we can work towards addressing how to provide the support together rather than parallel systems. Over.
Thank you. And finally to Andre, to whom a massive thank you for all his hard work on this. He's really been an outstanding consultant, but he's now no longer a consultant. Andre, last word, please.
Thank you. No, I mean, I don't represent an organization. I think what came out very strongly as part of this research was really the importance of functioning systems, starting from payment systems to registration systems to communication systems with affected populations, and how these systems can then be leveraged in an emergency situation, even though they were not necessarily designed for an emergency response. And this is exactly what happened in Jordan. I mean, nobody was really planning for a large-scale emergency, but yet the humanitarian actors were able to use these systems for a large-scale emergency response. So investing in systems and expanding them, that I think is really a key success for successful emergency response in these kind of contexts. Thank you.
Marvellous. So it's exactly 11:30 in Glasgow, Scotland, and I believe it's 1:30 in Jordan. And I would like to thank everybody for their participation and for the learning we've got here. As I said, the reports are now out in French and English. No, Arabic and English, and the French will be joining us soon. And we will probably share some learning about parallels, learning across two contexts with the Jordan and Lebanon work. So thank you again, and thank you for joining us, and have a great rest of day, everybody.